Hi, everyone. My name is Dennis Chilmingris. I'm an associate professor in the Department of Family Medicine and Public Health Sciences at the Wayne State University School of Medicine, and I'm also an IP faculty for Michigan AHEC, Area Health Education Center. And along with me are two other faculty. They're also IP faculty, Dr. Kathy Berlin. Can you please introduce yourself?
Yes, hi, my name is Dr. Catherine Ballant. I am an Associate Director of Simulation and an Assistant Professor at the College of Nursing at Wayne State University. I'm also an IPE Year 2 Scholars Faculty in the Michigan Area Health Education Center. And welcome.
Thank you, Dr. Berlin. Dr. Saad, would you like to introduce yourself as well?
Yes. Hello, everyone. My name is Aline Saad. I'm a clinical associate professor in the pharmacy practice department. I'm the director of faculty development and coordinator of interprofessional education for pharmacy. I am also an IPE champion who co-leads the year 1 for the AHEC Scholars Program delivery.
Great. Thank you both. So this is a presentation for the MIDOCS residents, and where we'll be talking about the AHEC Scholars Program. So basically, the AHEC Scholars Program is part of a national initiative to prepare health professional students and health professionals such as yourself become leaders in interprofessional transformative practice who serve those who need it most. The AHEC Scholars Program is also designed for scholars in the last 2 years of their program, whether that's medicine, nursing, pharmacy, social work, residency, such as yourselves. And also currently we are recruiting from those disciplines as well. In addition to the ones that I mentioned, we're also recruiting physician assistants and social workers. Also, the AHEC Scholars Program, provides supplemental training for the care of people in rural and urban settings, such as the ones that you, as MIDOC residents, serve. We also provide online learning modules and interprofessional team-based experiences as well. So basically, the AHEC Scholars Program is a 2-year program. The requirements are that you are in the last 2 years of your program. So basically, if your residency program is 3 years long, you would enter the program in the beginning of your 2nd year, and you would complete the program by the time you complete your residency at the end of your 3rd year. So the requirement is 80 hours total per year. It's the first 40 hours are basically the clinical training hours that you currently have from being employed as medical residents, and you can actually use those hours for credit. And then there's another 40-hour, which are the educational assignments. So for example, for year 1, and we'll talk about more of this later, you have to do online modules that you have to complete assignments. So that's your other 40 hours. And then in year 2, and we'll talk about this later, that also changes, because there's a quality improvement project that you have to do in the 2nd year. So in the 1st year, we have 8 core area topics: interprofessional education, behavioral health integration, social determinants of health, cultural competency, practice transformation, current and emerging health issues, connecting communities and supporting health professionals, and virtual learning and telehealth. So these are the 8 modules, and the way year 1 is structured, you have there's actually a synchronous component and an asynchronous component. So this is actually completing the online modules at your spare time. This is the asynchronous component, and I'm going to let Dr. Saad talk to you about the synchronous component, which includes 4 sessions that we do spread it. They're actually spread throughout year 1. Go ahead, Dr. Saad.
Yes, so Dr. Tsilomidis, if we can go back to the prior slide, please. So these are monthly modules that you are going to complete as part of year 1 of the AHEC Scholars Program. It is basically self-paced. We do check in with you multiple times to make sure that you are completing these by the set monthly deadlines. And in addition to these asynchronous modules, we will have 4 synchronous sessions, the content of which is either complementary to the modules or help reinforce content that was covered in the module. For example, synchronous meeting number 1 provides the scholars with an opportunity to work in teams and address the care of a patient in an interprofessional setting. Synchronous meeting number 2 discussed microaggression and build on the topic of DEI, social determinants of health, cultural competency, all included. And so we have 4 synchronous meetings. Those are, again, either to build on module content or introduce new module content, such as our last synchronous meeting focused on the community health worker. And these sessions are usually recorded as well, made available to you in case you miss them. We prefer that you be part of these synchronous opportunities to meet your AHEC Scholars colleague and get to establish a relationship with them. So all of the content is available on our learning management system called Moodle. So the Moodle learning management system is available to you. It's very similar to Canvas or Blackboard. It is accessible 24 hours, 7 days a week. You'll receive announcements, updates through that platform. And usually the program is available, or we start the year 1 program in October and finish the year end of May. So you have to complete all of the modules and the requirements by end of May to be able to be promoted to year 2 of the AHEC Scholars Program. Next slide, please. Okay, I think this is where Dr. Balint can chime in. Let's see, I think I've completed all of the content of this. Like Dr. Tsilomidis mentioned, every year is an 80-hour commitment. 40 of those hours are educational activity. The other 40 are your clinical hours that would be reported. And as we said, the content is self-paced, but assignments are date limited. And usually we kind of prefer that you complete every module on a monthly basis. And to be able to be promoted to the next year, you have to complete the year 1 modules by May 31st.
Dr. Bellin, would you like to discuss the year 2 curriculum, which includes the quality improvement project?
Yep. So year 2 is very similar in terms of hours to year 1. You have to do 40 hours of your clinical component, which is what you're already doing. And you have to do 40 hours of, we'll call it educational didactic piece that includes a quality improvement project for a total of 80 hours. Year 2 starts in October and it ends at the end of April. We do modules in telehealth. We also have modules that you do asynchronously on patient safety. And then we actually kind of the crux or the bulk of year 2 is dedicated to a quality improvement project that is done interprofessionally. So you're going to be required to meet as a group and form teams that are interdisciplinary. So it would be maybe nursing, medicine, pharmacy, social work, PA student, community health worker student, right? So you would form a team and then decide to look at topics that you need to look at for practice transformation or quality improvement. And because you might be from different areas, some on the west side of the state, some might be in the city of Detroit, some might be up north, way up in the upper part of the mid. Everybody will be able to, Christy Price, who is some of the other faculty that teaches in year 2 with me. We meet with you on a synchronous basis, first of all, to explain what the project is, help you get into your teams, and then talk about how you're going to function as a team so that you can get the project done. I.e., if you're gonna maybe do use of best practice in antibiotic administration, right? Maybe somebody as a medical student is at a federally qualified health center that's doing their clinical, and that would be the clinical site that they would actually do the quality improvement project. Where it might be a pharmacy student that looks at best practice, and a nursing student that looks at how do we utilize a specific logic model to get the quality improvement project going from beginning to end and within the evaluation process. So we have several past projects. The group at the end of the year in April, you will create a poster presentation like you would at any conference that you're presenting your results of your quality improvement project, and you do that presentation. And we did this live for the first time this past year, and it was a very well done program, very well attended. And everybody was very happy, and it was well received. And some of the topics talked about team huddling. We had a vaccine hesitancy. We also had, there was once in the past improving COVID-19. Somebody did a quality improvement project on stasis ulcers and wound care for people in a harm reduction program at a safe injection at a needle exchange program. So there's a multitude of areas that you can understand where interprofessional practice would be key. And understanding how to do quality improvement is a key educational piece that all healthcare providers need to understand how it operates, how it processes, and what's your role in a quality improvement project and transformation of care project. We do 4 synchronous sessions, and we also type in and say, hey, is everybody okay? Does anybody need to meet? We do that a couple times within the semester on top of those 4 synchronous sessions. And very interactive. We try to keep in good communication, ask you to give us the titles of what your projects are, and help you along the way to define who's going to do what and what people's roles are within the team to make your projects as successful as possible. So that's kind of like the gist of year 2. And I think that's it. I think I covered everything within our year 2 process.
Thank you, Dr. Bellman. And so some of the student benefits for becoming AHEC scholars is that, first of all, the program is free. There's also several opportunities for paid conference attendance. I know the National AHEC conference occurs every 2 years nationally, and you do have the opportunity to submit your research and present your research at that conference. And we will do our best to provide funds for that conference for you to attend. Also, we do provide interprofessional training skill development. Also, this is something that you can include on your resumes or CVs. Those of you, of course, after you complete your residency, you're applying for a job. So this will make you more marketable, especially in rural communities and inner city communities as well. There's also an opportunity to work with other scholars across the state in urban and rural health environments. As you know, we have 5 regional centers. We have the Southeast Regional Center, which is in the Detroit area. We do have Mid-Central Regional Center. We have Western Regional Center. We have the UP Regional Center and the Northern Lower Regional Center. So we basically cover the entire state. And then finally, the National AHEC Scholars also offers, a designation like a certificate that you have completed the program. You also will receive one from Michigan AHEC. And that's pretty much it here. This basically is a list of the faculty that you can contact if you have any questions. And we actually will start recruiting. Actually, the recruitment period has already started. And then the program actually begins on October the 1st, fall. So please, click on the link as you see here to apply. HTTPS //formstack.io/94218. And if you have any questions, you see for more information, you can visit us, you can email us at ahecscholars@wayne.edu, and we'll be happy to answer any questions you might have, and we hope to see as many of you apply for the fall. Thank you very much. Well, thank you all. I'm going to end the presentation. Thank you for your presentation. Thank you. Bye, guys.